Thank you, Susan. Thank you for having me here and tell the public about the new health services that are on the horizon for PNG citizens. Pacific International Hospital, commonly known as PIH, first started its operations as the first diagnostic center in this country. PNG Diagnostic Center in Port Moresby brought the first CT scan in Papua New Guinea. And from there on, we've continued to bring advanced medical technology in the private healthcare. Sometimes it's come in the private healthcare even before it's available in the public healthcare system. And this includes things like hemodialysis. For example, diabetic patients who have kidney problems, in order to continue to live, they need to be on kidney replacement dialysis therapy that we are able to provide at PIH. PIH has grown into a semi-tertiary level hospital. It has a 2-bed ICU available. And going forward, the MVIL hospital that was completed about 13 years ago, and what a lot of people in Port Moresby refer to as the white elephant on the hill, has been awarded in a very rigorous tender to Pacific International Hospital by IPBC to commission it as an international class hospital in the country. And we are proud to be part of this public-private partnership venture. And we look forward to bring services to PNG which are currently unavailable in the health sector, for which Papua New Guineans who can afford to go overseas are able to go and seek this care. But we hope to bring these services at an affordable price so that people can have access to these advanced medical treatments here in the country. Our main aim as we go into this expansion is going to develop a cardiology center where we are able to do interventional cardiology. You know, now when people come to the hospital with a blockage in their heart blood vessel, there is not much that can be done in Papua New Guinea. But if they have a blockage in their blood vessel in the heart, that blockage needs to be opened up. So the first thing that's going to be introduced is cardiac angiogram in a setting that's called a cardiac cath lab that is being developed. And that will be able to diagnose if a person has a blockage that is causing the heart disease. And we will be able to do what's called angioplasty, what people call as putting in stents or balloons to open up these blockages and keep the heart blood vessels open, which improves the patient's lifestyle and of course their lifespan. We know that cardiac disease, along with diabetes and other lifestyle disease, is also becoming an issue in Papua New Guinea, along with the maternal mortality and child mortality rate and infectious disease. Malaria still continues to kill a lot of Papua New Guineans, and of course a lot of work needs to be done on that. But at the same time, I think in the private sector we are taking the lead, and through this public-private partnership, to offer more tertiary healthcare to Papua New Guineans. This will also see the introduction and improvement in neurosurgical care. We will be bringing equipment called an MRI to do diagnosis. It's kind of like an X-ray, but a much more advanced one, which is not available in Papua New Guinea now. We will be introducing orthopedic, so joint replacement surgery, urology. So there'll be much more super specialties that will be introduced to complement what is available at the Port Moresby General Hospital and other provincial hospitals. And we hope that the new hospital will also provide avenue for training of more specialized nurses, and collaborating with the University of PNG and the public hospitals to allow the doctors to have more specialized training available as well. We will be collaborating with some international hospitals to be partners so they can help us develop the different specialties in Papua New Guinea. Susan, the new facility that we will be moving up into, currently world-class facility, as good as I have seen any in Australia or America where I have been trained. So I think it could even become the pride of the Pacific, where we would not only be able to help Papua New Guineans, but even our Pacific neighbors, and take the lead in providing advanced medical care at an international standard.
you.